Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month I'm talking about removing the element of surprise from healthcare bills and improving the value of care. I'm referring to the fact that even though many consumers with insurance do their homework and are diligent about seeking care in-network, they continue to be surprised by out-of-network bills. This is frequently due to services like radiology or pathology that are delivered by out-of-network providers at in-network hospitals. People think they've followed the rules only to get hit with a bill they weren't expecting. For one thing, all insured patients should be alerted to seek price information from out-of-network providers, as HFMA's Price Transparency Task Force recommended last year. Even though a hospital often doesn't know which individual physician will provide a service, it typically knows if any of the medical groups likely to be involved are out-of-network. Let patients know if and when they will need to confirm network status. But we realize this is just a step in the right direction, not the whole answer. In some states, legislation has been passed to address surprise bills. It's clear that we all need to join forces, hospitals, physicians, and health plans, to keep improving transparency about network status and prices in general. It's important to keep in mind that price transparency isn't just about prices for scheduled procedures. For example, I just read about a patient who went to the emergency room with what turned out to be a sprained ankle. The ED doc gave her a boot to wear after advising her that the boot might or might not help. What he didn't tell her was how much it would cost her. Weeks later, she got a bill for $1,000 for the boot, which she discovered she could have bought it online for about $70. Back in the ED, would she have accepted the boot, which she didn't end up wearing, by the way, if she had known how much it would cost her? Can't say for sure, but at least she would have had the information she needed to make a purchase decision. Can you picture this happening at the appliance store? Or when buying a car? I doubt it. Then why would we allow this in a healthcare environment? We shouldn't. And I know many of you share my sentiments. This is a missed opportunity, and they happen every day. Even though the amount involved might seem small, it was important to the patient. Important enough that she wrote her story down and submitted it to Costs of Care, a nonprofit organization that disseminates real-life stories about the personal impacts of healthcare costs. Costs of Care is working to help physicians and other caregivers understand how their decisions impact what patients pay. One way they are doing this is through a national story contest. HFMA is partnering with Costs of Care, along with Yale New Haven Health System and Strata Decision Technology on this contest. If you have a real-life experience or an idea that can reduce the unnecessary costs while providing better care, please consider entering the contest by sharing a short story or video. The deadline for entries is September 28th. For more information, visit our website at hfma.org/story-contests. When it comes to bringing about change, there's no substitute for sharing real-life experiences. The story contest will open source ideas to start a national conversation about creating a healthcare system that truly delivers value. I hope you'll join the conversation. I know you have great stories to share. Thanks for watching. I'll see you next month.